Hi, I'm Dr. David Hill, and today we're going to be talking about chamomilla to treat infant acid reflux. Now, when we talk about chamomilla, we really want to distinguish because there are two completely separate plants that carry the name chamomile or chamomilla. A lot of people think about the English plant, but most of the studies have been done on the German chamomilla. I guess there's a Roman and a German, really, but I think of the Roman as the English. It's confusing. But the German chamomilla is the one we want to talk about. Now, chamomilla has chemical properties that do seem to function, at least in test tube and in animal models, to reduce spasms within the colon. Now, whether this helps with gastroesophageal reflux disease remains a very open scientific question. What do we know that chamomile does do? Well, extracts of chamomilla in combination with some other herbals have been shown in a couple of studies to help with colicky crying in newborn infants. So there is some reason to think that chamomilla may be helpful for colic. That said, these studies were not terribly rigorous and none of them have looked at chamomilla in isolation, so we can't say that chamomilla really is the active ingredient in these studies. As far as studies to look at chamomilla for gastroesophageal reflux, absolutely none have been done and published. So while there's widespread discussion of it, widespread use of it, certainly a lot of people have tried it, no scientific literature has shown that it's safe and effective. That takes care of effective, but what about safe? Well, although this is an herbal remedy, it's natural. People think, well, it's an herb, it can't hurt me. That's not necessarily the case. Chamomilla is related in the flower family to ragweed. So children who have significant allergies to ragweed may also have an allergy against chamomilla, and you want to use it with some caution. Now, if your baby does seem to have gastroesophageal reflux disease, there are a lot of things that you can do for it that have been scientifically proven. And if you look that up, we have some discussions of treating gastroesophageal reflux disease in children that I hope you'll find really helpful. If you want to use chamomilla in a child without an allergy, it's probably not going to hurt anything, but the scientific literature is still out, some would say way out, on whether it's going to help. Talking about using chamomilla for gastroesophageal reflux disease in infants, I'm Dr. David Hill.